last but not least, definitely, we have two people presenting to us today. Rebecca Stewart is a current Master's of Nursing student at Trinity Western University, and she's also a research intern and staff member on several projects here at Trinity Western University. And today she is presenting from her thesis research on perceptions from Canadian-based civil society organizations on the global pandemic and its impact on equity in regards to the Sustainable Development Goals.
All right, thank you. I apologize, my notes are on the computer, so I'll be sitting down. I will not blame the baby for the reason I'm sitting down. I love doing that exercise. The baby was moving through that too, so that's exciting. But thank you so much for joining today, and just been very inspired to hear all of the conversations thus far. We'll move to a bit of a global perspective now from my thesis work that I've had the honor to work with Dr. Astle and Dr. Kendra Rieger on. And I also just want to mention that I absolutely align with all the beautiful land acknowledgements that we've heard, and just so grateful for Elder Patty's intro yesterday evening as well. And so just grateful that we are today on the beautiful traditional, ancestral, unceded territory of the Stewart peoples. So in 2015, the United Nations adopted the 17 Sustainable Development Goals that focused on the equitable betterment of all peoples as well as the planet by 2030. So the goals expand beyond maybe our understanding of global health into more of this planetary health perspective. Since their adoption, the COVID-19 pandemic emerged, resulting in unimagined multisectoral challenges and an urgent call to action towards the SDGs. Civil society organizations, which includes the umbrella of the non-governmental organizations or NGOs, which people may be more familiar with, were deeply impacted by the disruptions and devastations of the pandemic and its unintended sequelae, beckoning resiliency and innovative solutions to continue with their work. So prior to starting my research, literature review revealed a significant gap regarding the impact of the pandemic on CSOs and their work towards the attainment of the SDGs. So here is a few, just from a couple articles that ended up coming up, points of impact that was found in the literature. So a change of focus to COVID-19 related work, importance of partnership, the impact on donors and financial loss, and a role in advocacy. So with that, I sought out to explore how the global pandemic affected Canadian-based civil society organizations' services related to SDG attainment by asking the following questions. What has been the impact of the pandemic on CSO services related to SDG attainment? What gaps in services related to SDG attainment occurred during the pandemic, and then how did they navigate these gaps with their partner organizations? So I won't go into the depths of design here, but interpretive description was the methodological design. And it was used alongside a critical post-colonial feminist intersectoral framework throughout acknowledging power and equity dynamics. Purposive sampling was completed for Canadian-based civil society organization leaders who worked during the pandemic, and I ended up doing 8 semi-structured interviews over Zoom as it was during the pandemic. So Zoom was my friend and allowed to interview people from across Canada as well. With the last of the eighth interview being literally, I think, the week before I gave birth to the child before this one. So it's been a journey with my kids as well, which has been fun. And so 4 of the interviewees self-identified as female, 4 as male, and 4 of them worked for secular CSOs, while 4 were from faith-based organizations. So on to findings. An overarching theme was found that interweaves and connects the 3 main themes depicted in this visual diagram. The participants collectively described moving beyond the significant upheaval to rethinking how to work with an emphasis on working together. Novel approaches emphasize the importance of equity-focused work to continue moving forward in SDG attainment. Rather than the SDGs being an add-on or a nice-to-have, this overarching theme revealed their importance and innate presence through the equity-focused work of the civil society organizations, whether they were really even aware of it or not. The participants described a disequilibrium in their work because of the unavoidable and significant impact that was first seen in SDG 3, which is health and well-being, and then subsequently onto all of the remaining SDGs. One participant described the SDGs as a spider web, describing an interrelatedness or interconnectedness of the goals. Participant 7 also stated, one of the things that's been really highlighted through the phrase, the global pandemic, is just how much this has impacted all of us and how interconnected we all are. The pandemic has impacted people across the globe and exposed inequity. Theme 1 describes the evolving and unprecedented impact on the SDGs during the pandemic. The initial stages of the pandemic were a time in which the world seemed to hold its breath before moving into a state of emergency. I don't know if that resonates even just personally with what that felt like. This resulted in an initial pause in many of CSOs' programming, impacting SDG attainment. Participant 1 stated that they had to go down to the bare bones after evaluation of programming that had to continue, leaving them feeling as though everything was put on halt. The participants grappled with the reality of suspending their work and how to navigate the programming that was paused. However, amidst the temporary halting of CSOs programming, an urgency to continue with the critical work was recognized despite the instability of the pandemic. This urgency resulted in adaptations to continue with their work, moving into the next phase of finding equilibrium despite the ongoing chaos and turmoil that continued with the pandemic, which allowed them to reconsider priorities and actions. This re-examination, re-envisioning, and unearthing of priorities and programming was found to be needed during the pandemic and beyond. It allowed for re-engagement with equity-focused work, shifting to innovative practices and elevating the voice of those experiencing the greatest impacts from the sequelae of the pandemic, which has been touched on how many of these impacts affect the most vulnerable around us. Participants recognized their story provided a story about another story, the story of those in the global south. Most participants alluded to a need to be more cognizant we don't even understand what the realities are in the field, and that their own challenges were trivial compared to their colleagues around the world. Despite some of the progression in Theme 1, Theme 2 presents distressing gaps that affect SDG attainment. Participants discussed these gaps created due to a scarcity of resources. Participant 7 illuminated the importance of available resources in navigating the pandemic, stating, that's something that you think like, oh, but it's the same everywhere. It's just COVID. Yeah, but what resources do you have to deal with it? This lack of resources range from finances to raw materials to medical goods and services, including the people that we rely on most during these times, such as healthcare providers. Participants discussed the impacts of government policy dictating their programming and other available services. This prioritization led to gaps in their work, including healthcare funding and community needs, furthering inequities in the communities that they work alongside. Participant 4 expressed rationale for this narrow focus, stating, of course, when you're already under-resourced and you get hit with a big pandemic, you have to focus largely on that, and so that's had its own consequences. Many of the increased gaps in programming needs were due to the ripple effects of the pandemic and negatively impacted SDG attainment far beyond SDG 3, health and well-being. So, moving on to more of the hope side of things with collectively navigating the gaps. Theme 3 describes how navigating the gaps was possible for CSOs due to an emphasis on partnership. Without strong internal and external relationships, work towards maintaining the SDGs and the turmoil of the pandemic would not have been possible. The CSO leaders described multiple types of relationships that were strengthened or forged during the pandemic, including relationships within their own teams, as well as external relationships through donor organizations, other international CSOs, governments, and for-profit groups. Trust within the partnership and the infrastructure to be able to communicate virtually were found to be key for the maintenance of the partnership and continuation of the work. Participants described how the nature of a CSO already at baseline requires some flexibility. However, the pandemic pushed this into new areas, a willingness to change the way programming was done or the type of programming altogether resounded throughout the interviews. So we're currently working on the discussion phase of the study, but preliminary points include emphasizing the importance of moving towards decolonizing practices, a shared commitment to equity, strengthening partnerships, and preparing for future pandemics. And ultimately, to maintain the SDGs during the global pandemic, it was revealed that CSOs had to partner with their communities and other organizations to protect and serve the health and well-being of the communities they were in, and ultimately the planet. The different terms for that we've been talking about and aspects of the SDGs that focus more on the planet weren't as explicitly talked about from the participants. However, that theme still of protection for the planet was so evident that just in how interconnected every aspect really is. And so, yeah, that is a bit of where this journey has led thus far, and I just want to thank my participants very much, and of course my thesis co-supervisors who, without your wisdom, encouragement, and countless hours, I would not be where I'm at this point, so thank you. If there's any questions, I'm happy to dive into more details because, of course, in 10 minutes it's quite an overview. Yes?
I just wanted to hear about, in this process, and discover what surprised you the most about what you were learning.
Definitely. I think, there's many things that come to mind for sure that were surprising, but I think just how clear it was to participants that even if their organizations were very focused, say, on like a medical health strengthening system or some sort of like very clearly aligned with just one SDG, how throughout their interview, even if they were unaware of it, they were talking about all of the other aspects still. And so just seeing how one of the points actually was there's a challenge that was represented was there was heightened ambiguity in how to navigate because they're realizing now that their work is actually touching on all of these areas, but now how do we actually do them well? And so, it was really interesting just to see how, whether they knew it or not, they were really touching on all of these different areas that have been highlighted as crucial to be working towards. Thank you for your question.
Yeah, thanks, Rebecca. I really love that you used a visual with your description. That isn't always done, so congratulations on that. I think that was really effective. Did they talk, and I may have missed it, did they talk about SDG 13, about climate action?
So that was not one that was explicitly talked about. However, they talked about supply chain and lack of traveling a lot and some of these other pieces that then directly do impact that. And so that is an interesting piece now and looking back on, even if things weren't explicitly stated, seeing how did these now then continue to impact other aspects of the SDGs. So yeah, I think that it does speak a little bit to just how emerging and like crucial this topic of planetary health is, that some of these issues aren't forefront on their minds, but then they're still innately working towards some of these pieces. So yeah. Yeah.
Thank you for that, Rebecca. This is interesting. You spoke about innovative changes and programming, changes in programming being done. Were there any things that came up with what types of changes were done?
Yeah, definitely. That's a great question. The use of technology was a huge one, and not thinking that because they're working in areas in the global south that technology therefore couldn't be used. So there was a lot of a shift in their thinking of like how we can actually utilize this well and not come from this colonial perspective that it can only benefit us here. And so there was a lot of different use of education and training models through technology, and as well as business platforms that were started in countries that previously maybe didn't utilize WhatsApp for some of those purposes, but they actually use WhatsApp very regularly, maybe rely on it more than we do in some ways. And so the use of technology was a huge one. And then some of the change was instead then actually just moving their priorities to what the communities actually were saying were needed, instead of what, especially during the pandemic, it would be very easy to say, or focusing just on healthcare needs, right? And instead saying, oh, the communities are recognizing they don't have food, so maybe we need to prioritize that. And so that was where some of the more shifting occurred as well.